Hello YouTube, I'm Dr. Fox. Today, I'm talking about why a pregnant woman advised to have a full vaccination. Some people thinking that having the flu is just having a bad cold, but in fact, it's a different illness entirely and can be much more dangerous. You know, you have flu if you suddenly start feeling tired, you have a headache and your muscles ache, you're coughing, your throat is sore and your nose is running and your temperature shoots up, and you have some combination of these symptoms. Certain groups of people are more at risk of getting flu than others, and pregnant women are one of them. This is because your immune system is weaker during pregnancy, so you can't fight off infection as efficiently. Flu can cause several complications. The worst is bronchitis, which is the chest infection which can become pneumonia, which in turn can, in the worst cases, lead to death. You may also get an infection in your ear, your blood, your brain, or your spinal cord, all of which can have extremely serious outcomes. And not only will flu be more dangerous to you, possibly even fatal, but it can also increase the risk that your baby will be born prematurely, that is, before 37 weeks, or with a low birth weight. It can even lead to stillbirth or to your baby catching the illness from you and dying during the first week of her life. This is why you should make absolutely sure you have a full vaccination if you are planning to get pregnant or if you're already pregnant and you haven't been immunized. Having a full jab doesn't only protect you, it protects the baby inside you. Okay, question. Is there any risk to having the flu vaccine? My answer is no, although there are people around who will tell you that all vaccines are dangerous. They are wrong. All the scientific research tells us that vaccination is vital and will keep you and your baby safe. In particular, some people have claimed that the vaccination can cause your baby to be autistic, but there is no scientific evidence for this. When you have the vaccine, it triggers your immune system to create antibodies which will fight off the flu. These antibodies live in your bloodstream, and if the flu virus enters, they call other parts of your immune system to destroy it. It takes your body a little while to create these antibodies, so you won't be protected against the flu until about 2 weeks after you have the vaccination. You may briefly experience some mild side effects from having the vaccine, including soreness where the needle went in, a slight temperature, and aching muscles. However, the vaccine doesn't give you flu as it does not have any live virus in it, and it is rare that there are any other side effects. If you are ever in any doubt, you should talk to your doctor, nurse, or health professionals. Next question. When should you have the full jab? We advise you have the flu vaccine in the autumn, as most people get the flu during the winter. If you haven't managed to do this and you find you are pregnant, go ahead and have it during the winter so you can be sure you're protected as soon as possible. You should also remember that even if you had a full vaccination last year, you need to have another one because the flu virus changes every year. Next question. How can you prevent yourself getting flu? The single best precaution is getting the vaccination. Other things to do include regularly washing your hands with soap and warm water and making sure the surfaces you regularly touch are clean. For example, your phone, your keyboard and mouse, and door handles. If you cough or sneeze, cover your mouth and nose with a tissue and put the tissue in the bin as soon as possible, not up your sleeve or in your bag. Importantly as well, you should not have close contact with someone who has the flu, which includes face-to-face conversation with them or even just sharing a house with them. Okay, next question. Can you have the full jab at the same time as the whooping cough vaccine? My answer is yes, you can, but the ideal time to be vaccinated against whooping cough is between 16 and 32 weeks of pregnancy, although it's different from country to country. So, if you are less than 16 weeks pregnant, have the flu vaccination anyway. Don't wait to have it at the same time as your whooping cough vaccination. Last question, what should you do if you think you have the flu while you are pregnant? If you think you have the flu and you're either pregnant or your baby was born in the last few weeks, contact your doctor or nurse immediately so they can check and, if necessary, prescribe an antiviral medicine for you. Don't delay, as this type of medicine works best if you take it within 48 hours of the first symptoms. Antiviral medicine doesn't cure the flu, but it can reduce the severity and length of the illness. Okay, thank you for watching. See you soon.